special live town hall to provide information about COVID-19 vaccines for 5 to 11-year-old children and answer your questions. My name is Dirk, and I'll be your moderator tonight. Also joining by phone and looking forward to answering your questions are Dr. John Douglas and Dr. Bernadette Albanese from the Tri-County Health Department, as well as Caitlin Silverstein, an immunization nurse who will answer a lot of questions tonight. To participate, please press star 3 on your telephone keypad at any time to ask a question of our guest live. Or you can submit your questions on our website at arapahoegov.com/town hall. Again, the website is arapahoegov.com/town hall. And now, let's hear from Dr. Douglas on what's happening with the future of Tri-County Health Department and provide us with a COVID-19 update. Dr. Douglas, take it away, sir.
Thank you very much, Dirk. Great to be with everybody this evening. Let me just say a couple of words about the future of Tri-County. I think many folks are aware that we've been serving Arapahoe, Adams, and Douglas County as part of a district health department since the late 60s. There are some transitions underway in that Douglas County has got plans to set up their own health department, and Adams may be doing likewise. We will be providing services to all 3 counties, at least through the end of 2022. We're having lots of conversations with the community, with key elected officials. We want to be really thoughtful about what the next steps are. Whatever transition happens, let me say, will occur as seamlessly as possible. And again, none of these transitions will really be occurring until the end of 22, by which time I certainly hope the worst of the pandemic is over. Who would have thought it would have gone on this long? Speaking of the pandemic, let me give you an update on where we stand. And in the words of the dean of our local Colorado School of Public Health, right now Colorado is in, quote, shockingly bad state. We are seeing case rates higher than any point since the bad times last November and December. We are also seeing hospitalizations increasingly tight as well. At the present time, and this is both statewide as well as in Arapahoe County, at the present time, it looks like, for example, in Arapahoe County, we've got fewer than 1% of our ICU beds in the hospitals free, meaning available to take care of new patients, and about 3% of beds in general. Arapahoe County has had 94 new hospitalizations in the last week, and while its rate adjusted for population is among the best in the state, its actual numbers of people getting hospitalized is in the top 3 of the state. One of the big questions is why in the world is this happening? We've been doing vaccination for, close to 10 or 11 months now. What in the world is going on? And what appears to be going on in the hospitals is, number one, we are still actually seeing folks sick with COVID in the hospital. We've got the most COVID patients hospitalized since right before Christmas of 2020. This is largely among people who haven't yet chosen to get the vaccine. 80% of the hospitalized patients are those that are unvaccinated. We are, however, beginning to see some breakthrough infections occur, especially in older folks, and that's a reason why booster vaccinations are being strongly recommended for anybody who's more than 6 months since their second dose of a Moderna or Pfizer vaccine, or 2 months after a Johnson & Johnson vaccine. Reason number 2 is, frankly, the sort of things that happen in hospitals in general: appendicitis, heart attacks, car accidents. Those are all happening. And to the extent that we've gotten much closer back to the lives we used to live, we're frankly seeing more of those things than we have when we were quietly not getting at in society quite as much. Thirdly, we are seeing folks who probably didn't get adequate preventive care over the last year. They were perhaps concerned about going into a hospital with a problem, or they may have had a procedure that had to be delayed because hospitals were so stressed out. And so cancer diagnoses that didn't get picked up as early as desirable, cancer treatments that didn't get administered as early as desirable, these are also occupying beds. I think the thing that worries me the most, though, is the fourth thing, and that is that we've got actually fewer staffed hospital beds across the county and the state. And this is not because the beds have melted away or the ventilators have disappeared. It's because we don't have the staff. The healthcare staff, particularly our nurses and our respiratory therapists who've been working just unbelievably heroically now for over a year and a half, are frankly getting burned out. And we simply have got fewer beds that can be staffed in a hospital to take care of people. Now, that's the dark side of the story, and I always hate beginning a topic or a town hall on this topic as optimistic as pediatric vaccines with that dark side. But I do want to say the light side are vaccines. And while these vaccines are not perfect, if somebody could mute, I'm hearing you and others maybe as well. These vaccines have really been an extraordinary game changer. And if we can get them adequately implemented, meaning if we can get everybody who's eligible for a vaccine vaccinated, and we can get those who are eligible for a booster, which, as mentioned, is most of us who've gotten our course of vaccine so far, we think we'll be in far better shape. What we're recommending at this point in time, in addition to vaccination, however, because we are in this somewhat challenging setting, is the reminder that wearing masks in public indoor spaces, even if you've been vaccinated, can be really valuable. That you should try to socialize and be together in settings in the outdoors. The great outdoors is a great friend in terms of COVID transmission prevention. Please, if you are sick, stay home and get a test so you can determine if you have COVID or not, and you can make yourself, or rather take advantage of the treatments that are available, the monoclonal antibody infusion treatments that can apply to about half the people who get to COVID can be really, really valuable in terms of preventing hospitalization. And finally, not to forget, it's flu season, and if you haven't gotten a flu vaccine, it's a great time to get it. Let me turn the reins over to my colleague, Dr. Albanese. Dr. Albanese is the medical epidemiologist at Tri-County. She's a pediatric infectious disease expert, and I can't think of anybody better to talk about vaccines for kids ages 5 to 11. Dr. Albanese.
Thank you so much, Dr. Douglas. Good evening, everybody. Thanks again for taking time out of your busy day to be with us tonight. So this is great. So I'm just going to give you a very quick kind of high-level summary of what this pediatric vaccine for 5 to 11-year-olds looks like, and then hopefully we can jump into the questions. So to start, let's remember how much COVID vaccine has been in use in the United States since it started. Dr. Douglas mentioned, we're 11 months now, into this vaccine campaign. And I think to also begin with a bit of good news, right? So in the United States, there's been over 500 million doses of a COVID vaccine administered, in the U.S. Over 12 million persons 12 and older have been receiving this vaccine. We have 220 million people in the United States vaccinated, meaning they've either gotten their 2 doses of the Pfizer or the Moderna mRNA vaccine, or they've gotten their 1 shot of the Johnson & Johnson vaccine. So that is good news. Why am I mentioning those numbers? I'm mentioning them because this is not a new vaccine anymore, right? And we get a lot of questions about, we don't know about the vaccine, there's so many unknowns. We know a lot more about the vaccine than we don't know. 500 million doses in the U.S., plus all of the doses of the same vaccine being used internationally, for which, we exchange information with other countries about their vaccine experience. That's a lot of vaccine being used. Well, it's a ton of vaccine being used. And so we do have a lot of information about the experience in using these vaccines. We do have a lot of information about how well they work, particularly to prevent the worst of COVID, which is severe illness, hospitalization, and death. Dr. Douglas giving you a lot of hospital information and strains that we have on the system right now, a lot of which is still related to COVID. We have had challenges with the vaccine and the Delta variant, right, that new strain of the COVID-19 virus that has pretty much taken over our country and taken over the world. It is what's causing all the COVID disease right now. It's very, very catchy, 5 or 10 times catchier than the original virus that we started with back in 2019. And it's causing a tremendous amount of illness in children, particularly in school-age children, particularly in children 5 to 11 years of age, and our adolescents as well. And maybe we can talk more about that later. So there is a need for this vaccine. As Dr. Douglas mentioned, we're in a massive, massive surge of cases in Colorado right now due to the Delta variant, due to how contagious it is, and due to people who remain unvaccinated. And guess who's unvaccinated right now? Well, until about a week ago, 5 to 11-year-olds. And they, in fact, have the highest rate of disease in any other age group in the country and in Colorado. So it's time, right? It's time that we have an option now to help children, help protect children, 5 to 11-year-olds, against this infection, against this disease, and to keep them in school and keep them healthy at home and with their friends and family. So this vaccine is made from Pfizer. It is an mRNA vaccine. The makeup of the vaccine is the same as the other, is the same as the Pfizer vaccine used in adolescents and adults. It's an mRNA vaccine. It's made the same way. The major difference with the formulation of the vaccine, the way the vaccine is constructed for 5 to 11-year-olds, is that the dose has been adjusted to be appropriate for younger children, right? So Pfizer has been making vaccine for a very long time, and so we know that when vaccine is introduced into younger children, pediatric age group, we have to adjust the dose because they're younger. And so the pediatric formulation is the term that we use. So the vials that we use, vaccine vials for the 5 to 11-year-old children, have an appropriately and studied lower dose than what's used in adolescents and adults 12 years of age and older. And again, there were clinical studies done to identify what is the best dose to use in children that will give us a good immune response, an immune response that essentially is equivalent to what we see in adolescents and adults, but that is appropriate for their age. Other than that, it's the same vaccine. So because it's a Pfizer vaccine and an mRNA vaccine, it is 2 doses. You get 1 dose of the appropriate 5 to 11-year-old, the appropriate dosing vial, and 3 weeks later, get the second dose, just like we do in adolescents and adults. And then we consider, 2 weeks after the child receives both doses, they would be considered fully protected. So that part of the dosing regimen is the same. Other quick question that I'll just answer now in advance is, side effects after the vaccine. And the Pfizer study that followed this, the most common side effect was a sore arm. So pain in the arm where the injection was given. The injection goes into the muscle, and so it gets a little sore. And then the next most common was some tiredness and headache. These were short-lived symptoms, a day or two, and they typically resolve. There were no really significant, so there's a lower risk of maybe having, a little bit of a tiny bit of fever, but much less common than the others. But really, sore arm, tiredness, and headache were the most common symptoms, and there were no serious side effects observed in the vaccine trial, which continues, which is ongoing and continues to follow these children that received the vaccination. So there is a question about where to get vaccine. I'm gonna just answer that real quick. So right now, the best place to first look to get COVID vaccine for your child is to call your pediatrician and see if they have it. They're carrying it in the office carrying the 5 to 11-year-old dosing in their office and go there. That is your trusted doctor for your child. And many of the pediatricians, we were looking into this in our Tri-County area, so in Adams, Arapahoe, and Douglas counties. Hopefully, we're estimating about half to two-thirds of the pediatricians will be COVID providers. They're actively sort of getting on board in terms of receiving vaccines. So call your doctor first, see if they're a provider, and if they are, we suggest going there so you can have a nice conversation with the pediatrician before you get dosing. Other locations are local pharmacies. So our big pharmacy chains, like our Walgreens and so forth, contact them to make sure that they are offering a vaccine for 5 to 11-year-olds, but many of them are, and they're getting stocked up on the vaccine. Our Tri-County immunization clinics are offering vaccine for this age group, and Children's Hospital is also setting up some clinics, so that anyone from the public can come in. The vaccine is free, as it's always been, and maybe at some point Caitlin can fill in some of the gaps too about vaccine access. So, Dr. Douglas and folks, I'm going to stop there and see if we want to move on to questions. Thank you.
Dr. Albanese and Dr. Douglas, thank you for your updates. It is definitely time to get to questions, but as a quick reminder, if you have a question you want to ask our experts, please press *3 on your telephone keypad. Again, press *3 to enter the question queue. You can also submit your question through our website by going to arapahoegov.com/town hall. Again, arapahoegov.com/town hall. And looking here, we've got an online question submitted by Larry. Looks like a good question for Dr. Albanese. Doctor, would any new variants of COVID neutralize the effectiveness of the vaccines?
Yeah, hi. Great question, Larry. So the issue with new variants will be the same regardless of any of the COVID vaccines. The Delta variant right now is in control in terms of the strain, the type of the COVID virus that's causing illness, and it is grounded. And it's really been that way. It's been that way in Colorado since July, and then for the most part, some areas of the country got hit a little bit earlier than we did Colorado, but it is grounded. So we monitor the variants very, very closely in public health, and I tell you, the Delta is not budging. And in fact, I've heard some of our vaccine experts around the country going, this thing is so catchy, and is doing quite unfortunately infecting people who haven't been vaccinated yet, that they're not sure that they can find anything that's any catchier than the Delta variant. But when new variants do begin, if it happens, let's all collectively cross our fingers that it doesn't happen, but if new variants begin to emerge in the United States, the vaccine manufacturers will take that to the laboratory and continue testing the antibody response from their vaccine to see how well it works against the new viruses if they emerge. So that's always ongoing.
Thank you very much, Doctor. We've got another online question. This one was submitted by Chris, and it looks like a good question for an immunization nurse, and it just so happens we have one with us. Caitlin Silverstein, this one's coming to you. The question is, can my child get a flu shot at the same time as the COVID-19 vaccine?
Hi there, Chris. Great question, especially as we're entering the winter months and respiratory illnesses are definitely on our minds and definitely of concern. Current CDC guidelines do state that COVID-19 vaccine can be administered alongside other vaccines, including the flu vaccine. So those can absolutely be administered during the same visit. Thanks so much.
Thank you very much, Caitlin. Again, as a reminder, if you've got a question you'd like to ask, please press *3 on your telephone keypad to enter the question queue, or, as people have been doing so far this evening, they've been submitting them online, and you can do so at arapahoegov.com/town hall. All right, we've got Susie on the line with us right now, and Susie's joining us to ask a question, and I think this question is a good one for Dr. Douglas. So, Susie, welcome to the call. Go ahead with your question, please.
Thank you. I have a 6-year-old, and I'd like to get her vaccinated. I've heard there are possible side effects with the muscle around the heart. What symptoms should I look for in my child to see if they're having the side effect? I'm really worried.
Hi, Susie. Thank you. That's a really important question. What you're referring to is a condition called myocarditis, which basically means inflammation of the heart muscle. It is something that was seen or has been seen rarely in adolescents and young adults, as it turns out in males more than females. The trial that Dr. Albanese mentioned, a couple of thousand kids in the Pfizer study had no occurrence of myocarditis in the younger kids. Now, it's a relatively small trial, even though it's several thousand. And so it is possible that as we give more vaccines to kids, that could emerge. The symptoms that your son would manifest would be most likely chest pain, because he's, if you will, got inflammation in the muscle of the heart, or potentially shortness of breath, because when the heart gets inflamed, it may not pump quite as effectively as it normally does. I want to make it really clear again, these are possible side effects, but they're expected to be very uncommon. And if your son does get a vaccine, which I'm very happy to hear you're considering, those would be the side effects to look out for. And if they develop them, contact your provider or go to an urgent care clinic.
All right. And just to make sure, is there anything you'd like to add to that, Dr. Albanese?
Thank you. Thank you, Dr. Douglas. Please note, this is a very, very, very rare reaction, and as Dr. Douglas mentioned, that has been observed in vaccine recipients 12 to 29 years of age, most commonly when it does happen, which again is pretty rarely, and more commonly in males. But we're still talking about something, so out of 1 million doses given, the possibility of this happening, ranging from, 10 to 50 cases out of 1 million people vaccinated. So it's extraordinarily uncommon. So you'll have 999,000, 900 people vaccinated with no issues. But it is a good question, and it is, something that was unusual going on within the week after vaccination to seek care for that. But it is extremely uncommon. And in fact, kids who get COVID infection just the COVID infection itself can cause inflammation of the heart. And that complication is actually more common than the small risk that would happen after vaccination. So all in all, a very unlikely scenario, but a good question. Thank you.
Thank you, doctors. And we're going to go back to an online question, and this one was submitted by Jessica. She asks, will children be on the same vaccination and booster timelines as adults have been? Let's go ahead and throw that one at Caitlin Silverstein. Caitlin?
Yes, thank you, Jessica. That's a great question. So the primary series for both that 5 to 11 pediatric formulation and the 12 and over formulation for 12 and up, they do follow the same schedule for that primary series, which is 2 doses spaced 21 days apart. The dose is different between the 2 products. The pediatric version is only 1/3 of the adult version, but the schedule is the same, 21 days spacing. As for boosters, booster doses are only recommended right now for 18 and over. There's no recommendation for booster doses for under the age of 18 as of right now. Thanks for the question.
Thank you, Caitlin. And let's go back to the phone. We've got Joshua from Centennial joining us on the line with what looks to be a good question for Dr. Douglas. Joshua, you're live. Go ahead with your question, please.
Hi, sorry about that. We had you on mute. Hi, thanks for putting this together. I'm curious, how many kids are filling up your ICUs now that have COVID? And, okay. Good, sorry.
Joshua, just be clear, how many kids are in ICUs in Colorado now due to COVID?
Yes, sir.
Yeah, I can't tell you the ICU part of the equation. I can tell you from information shared from Dr. Herlihy, our state epidemiologist, that currently hospitalized kids, either ICU or non-ICU, was 27 as of 3 days ago. I don't know if Bernadette has any more ICU-specific information, but that gives you some general frame of reference.
I don't have any specific. I don't have any specific numbers on ICU around the state. I will say that Children's has been very busy with COVID lately, including some significant, severely ill children.
I feel that we're very lucky then, because most of the people, the families that we've known that if their children have COVID have headaches, and like they said that their coughs for a common flu were worse than COVID for them. So with all the side effects and all these amazing numbers that you were throwing out, I'm in the trial still going on for children. I'm really uneasy about getting my children this vaccine at this young of an age. And if my pediatrician says that they don't recommend it, I'm just having a hard time accepting this. Thank you.
This is Dr. Albanese. I can just offer a little bit of context about the pediatric experience with COVID and certainly from a national perspective too. So, children, in general, children across the board, if you compare children with COVID to all adults with COVID, in general, children will do better because children are healthier in general, don't have as many, chronic underlying health conditions. And that's true for lots of things, however, children aren't at zero in terms of severe disease. So a little bit of data from the national perspective. So since the beginning of the pandemic, there's been almost 2 million cases of COVID reported in children 5 to 11 years of age. There's been approximately 8,300 hospitalizations. So that's 8,300 sets of parents or guardians who've had to have a hospital experience with their child with COVID. I checked this morning, there's been 190 deaths in children 5 to 11 years with COVID. That's the saddest number. No, it's not a gigantic number, but it's a sad number to have parents have that experience with what was likely a previously healthy child, to have had that kind of devastating outcome. And in fact, CDC, when data was being presented to the CDC, said that COVID-19, if you compare the amount of COVID-19 deaths that we've had in the United States and compare it to the causes of death in children, and the data most available is 2019. So we're sort of looking at different time periods, but it would come in as the 8th most common cause of death among children. The other condition that can happen after a COVID infection in children is called the Multi-Inflammatory Syndrome. This is an unusual but severe complication of COVID that is quite frankly unpredictable and can happen after mild infection in children, or children who have infection with no symptoms, where there's a massive inflammatory response to the infection that involves the heart, the lungs, the kidneys, the brain. It's a severe infection. The children are hospitalized. Many of them end up in the ICU. And so that's scary. And I would also share that in studies that have looked at children who have been hospitalized with COVID, a third of them had no underlying medical condition. So no predictor, right, that your previously healthy kid would actually end up in the hospital. It was just a random event. You got COVID and boom, you ended up in the hospital because of the severity of your symptoms. And of the children who were hospitalized that had underlying conditions, two of the common conditions were obesity and asthma, which are also very common in children. So there's some things to think about in what can happen with COVID infection in kids. So I just wanted to share that with you. Thank you.
Thank you, Dr. Albanese. So we'll go back to an online question, but quick reminder, if you would like to ask our experts a question live on this call, all you need to do is press *3 on your telephone keypad. Again, if you have a question you'd like to ask, please press *3 to enter our question queue. Now we're going to an online question, and Caitlin Silverstein, the immunization nurse that's joined us on the panel this evening. This one's a good one for you. Larry asks, are there any common health conditions among children that would make it riskier to get them vaccinated?
Hi, thanks, Larry, for that question. So the vaccine, as we know, is recommended for children 5 and up. The main concern that we would have to not vaccinate a child would be a known allergy to the vaccine itself or to an ingredient in the vaccine. Besides from that, we do not have a lot of other reasons to indicate to us at this time that there's any additional risk associated with other health conditions. A lot of times children with health conditions may be at higher risk for complications with COVID-19, in which case the vaccine would be even more important. So we would be recommending the vaccine for those children. Thanks so much.
Thank you for that answer. Moving on to another online question, and Dr. Douglas, I think this is a good one for you. Alexis wonders, are school districts planning to mandate the vaccine in order to attend in-person classes? And if students apply for an exemption, will there be any testing or masking requirements that don't apply to vaccinated children?
Sure, Dirk. Thank you. Alexis, this is a really good question. I'm glad to see you thinking around the corner as to what might be coming. Let me say at this point that there are no plans for school districts or Tri-County or, as far as I know, the state to mandate the vaccine in order for kids to attend in person. Now, it's a very relevant question because there are a number of vaccines that are required for school attendance. These typically have included diseases such as measles or pertussis that could be transmitted in the classroom setting. I think most experts, and certainly the CDC would agree with this, that we would be wise to have more data on children and, frankly, to have full licensure of the vaccine in children. It is a vaccine for kids that's been studied in thousands of kids, but it hasn't undergone full licensure. So I don't see mandates happening anytime soon, although I don't think that's an implausible situation in the future, perhaps a year or so from now. And in terms of the question of might there be options or exemptions, I suspect there would be the same category of exemptions that we have for any vaccine, medical or religious. So I'm guessing that's how that would play out, but we're probably some time away from that being seriously considered.
Thank you, Dr. Douglas. I'd like to hold you over for this next online question. And so the question is, what about all the people that are vaccinated and still get COVID and still transmit it?
Really important question, Chris. Thanks for bringing this up. Is this Chris who asked me this?
I'm sorry.
I'm sorry.
Steve, I apologize for not identifying
Steve,
that, Doctor. Steve asked the question.
Apologies. Steve, really good question. So, when the vaccines first got developed, the endpoints in the studies were, did you get sick or not? The studies were not designed to test whether you might get an asymptomatic infection. After a couple of months, we began to collect data that actually suggested that asymptomatic infections, that is, being vaccinated, not really getting sick, but being contagious, probably occurred less commonly in vaccinated people. With the onset of Delta, we began to realize that was less true. There were some large outbreaks, including vaccinated people, who did appear to be able to transmit virus. What we know at this point is that the vaccines do protect, including Delta, against all forms of infection, but the protection is greater for serious outcomes, getting hospitalized or even dying, where your protective benefit is 90-95%. In contrast to being protected against milder or even asymptomatic infection where it may be only 75 or 80%. It's still a reduction. And in those people who do get an asymptomatic or mild infection, it appears that the duration of their infection, and therefore the duration of how long they may be contagious to others, is shorter, but it does happen. So it's I think a situation where the use of the vaccine or not using the vaccine because of that concern would be a case of, in some ways, letting the perfect be the enemy of the good. I will say that we do, but given the awareness that you can be vaccinated and still get a mild or even asymptomatic infection, is one of the reasons that in times when cases are high in our communities, like right now, that we do recommend that even vaccinated people wear masks in settings where others may be around. The vaccines work quite well, but not perfectly, and masks can help reduce that risk even further.
Thank you very much, Dr. Douglas. And as a reminder to everyone, if you'd like to listen into this conversation and ask a question through the website, arapahogov.com/town hall. Again, to ask a question through the website, that address is arapahogov.com/town hall. But you're also welcome, if you're listening to this conversation on your telephone, to press *3 to enter the live question queue and speak directly with our experts this evening. So again, if you have a question you'd like to ask, please press *3 on your telephone keypad to ask a question live, or go on the website, arapahogov.com/town hall. Got another online question here. This one is from Steve, and it looks like a good one for Dr. Albanese. The question is, why should we give an experimental drug to children for a virus with a 99 plus or minus % survival rate?
Thank you, Steve, for that question. We do receive questions like that as well at the health department. To frame that question, I want to go back to, so one of the reasons that I shared the data a few minutes ago about the experience with COVID in children 5 to 11 years of age is to demonstrate that it's not always a benign type of infection. Children do get hospitalized with it, again, albeit at a lower rate than results. Children, unfortunately, do die from COVID, albeit at a lower rate from adults, although comparatively, the deaths from COVID are with it being, I think it was the 8th or 9th leading cause of death in children when compared to 2019 data. So it isn't completely benign. Secondly, kids, the highest disease rates that we're seeing in Colorado right now are among children, elementary school children in the age group for which this vaccine is now available. Those children get infected after being exposed at home. They get infected after being exposed in school settings. Unfortunately, they get exposed after they can get exposed and get infected being with playmates or other family members or other adults. Once that child is infected, they are perfectly capable of spreading it around, quite efficiently, actually. And where do they spread it? They spread it at home. They spread it to their friends. They spread it to their family in their family gatherings, and they clearly spread it in school. We have been a rough school experience. We are trying our best. And our goal is to maintain in-person learning, so children have that very beneficial experience. So the reason we want to vaccinate kids is to disrupt that chain of spread, in addition to protecting the child themselves from severe outcomes, especially unexpected if they're previously healthy. We want to keep kids in school. We want to keep kids healthy at home. We want to keep kids from spreading it to 50% of their household members, which is what the studies show can happen. And we want to break that chain of spread so that kids can safely and confidently be in the school environment, be in the play environment, with friends and family, be able to have normal social interactions, and to have the benefits of kids being kids. And the vaccine is a good way to get And this is not an experimental vaccine anymore. 500 million doses have been used around the country, COVID vaccine been used around the country. The majority of that is mRNA vaccines. We build on that experience. We build on that data to have designed this, lower dose formulation for 5 to 11-year-olds, but it's not coming in cold. It's coming in hot, actually, based on the massive amount of information we've learned about using this vaccine in other groups. So please talk to your pediatrician about it, and they can also help fill in the gaps and help address other questions you might have. Thank you.
Thank you, Dr. Albanese, and I'd like to hold you over for our next caller. We've got Stephanie joining us on the line right now from Centennial. Stephanie, welcome to our call. Go ahead with your question.
Hi, thank you. I was wondering, the study I saw was only done with about 3,000 kids, which is smaller than the other trials that I've heard. How do you know that this is enough data to determine that the vaccine is safe for kids?
Thank you, Stephanie. Really appreciate that question. So you are correct. The official Pfizer clinical trial does have about 3,000 children in it, and that study is ongoing, monitoring them after vaccination. That clinical trial actually is a pretty average size for pediatric trials. So there's really nothing terribly unusual about that. And so, as I mentioned, what's going on with this trial is added to all of the safety monitoring that's been going on in the United States for the past, essentially the past year, and now almost a good year and a half plus, if you include the clinical trials that started with adults in 2020. So we have 4 large, robust, extensive vaccine safety monitoring programs set up in the United States, some of which have been designed specifically for COVID vaccine that allow reports of potential reactions to be reported not only from providers who vaccinate, but from people who have been vaccinated. That data is regularly examined. It is then cross-referenced with data. Surveillance systems, so systems with hospitals and providers that have been set up around the United States so if there's a report that comes in and this data is received by the CDC that says, this sounds like something a little bit unusual, I'm not sure if it's related to the vaccine, let's look into this more. There are other systems set up to rapidly evaluate data on persons' healthcare data, so their medical record data on people who have been vaccinated, to see if we are seeing a pattern geographically around the country and in more people that have been vaccinated. And so, we have the reporting that can come into CDC. We have, and maybe Caitlin can talk more about this, a phone app called vSafe that anyone who's vaccinated can sign up for. And to be able to report symptoms and report concerns that go to the CDC, and they evaluate that. And then if there's a signal that's concerning, it is immediately and rapidly vetted in these other healthcare systems to see if there's a pattern of the same type of complaint in terms of what people might think is a reaction among millions of people who have been vaccinated, to see if there's a pattern. So these systems, these vaccine monitoring systems have been in place in the United States for a long time, added with the vSafe that was added specifically for COVID. And so we're very, very, very good at being able to respond to unusual complaints. We're not talking about the sore arm. We know that happens after the shot. And so it is a very robust system, and we are bringing, the experience with 500 million doses forward to evaluate safety. Thank you.
Thank you very much, Doctor. And moving on, we've got Susan from Centennial on the line with us now. And Dr. Douglas, this looks like a good question for you to take. Susan, welcome to the call. Go ahead with your question.
Yeah, thank you. I just had 2 quick points. The first was responding to something Dr. Albanese shared with one of the callers a few moments ago around national COVID data, pediatric data for hospitalizations and deaths. She mentioned 190 deaths nationally, which is terrible, of course, but in Arapahoe County, Tri-County's dashboard shows only 4 kids have died with COVID. I'm certainly not trying to minimize those deaths, but I do think it's important to talk about the local impact for perspective. My main point, though, tonight is I'd like to highlight just what I consider the moving goalposts as it relates to keeping our kids in school, something you've all been talking about. Every parent is obviously focused on that. Dr. Douglas, you spent much of August and September telling families that universal masking was key to keeping our kids in school. I'm a Littleton Public Schools parent. As you know, there are thousands of kids right now who are currently on a 10-day quarantine, some for the second time this year. So we know that universal masking is not keeping them in school. The message from Tri-County is now changing to vaccinations are key to keeping kids in school. I mean, that's what it says on your website to promote this event this evening. My question for Tri-County is, why would any Arapahoe County family trust anything you have to say at this point?
Well, Susan, I'm not sure either of the points you just made are specific indictments of trust. Let me be clear about the mask issue. Masks have been shown throughout last year, and then through studies that have been pulled together and published this year, particularly one by CDC about 2 months ago. There's an unpublished study out of Colorado that shows that mask mandates at a district level are associated with many fewer cases than in districts where they're not mandated. Now, let me be clear about this. Masks are not perfect. They've never been argued to be perfect. They've been argued to be part of a series of mitigation strategies that schools use. When case rates get as high as they are in the community right now, as you may remember, Dr. Albanese talked about the fact that case rates among 6 to 11-year-olds are the highest of any age group. They're the highest they've been since the pandemic has started. Age rates among 12 to 17-year-old kids are, I think, only a third after 6 to 11 being the highest. When case rates get that high, imperfect measures, even though they're better than not using those measures, will not be perfectly successful. So I think the real question is, what would we have seen if masks were not being broadly used? And while we do not do randomized controlled double-blind placebo comparison trials for masks like we do for vaccines, the observational data that's been collected in lots of different locations continues to suggest that the masks are providing an added benefit. Now, why are we now advocating vaccines? Because we think vaccines can be a tremendous added mitigation measure. Are they perfect? No. Are they highly effective and safe? The data we have so far tells us yes. So if our goal is to keep not only kids healthy, but to keep adults around those kids healthy, but also to keep the schools in session, vaccines will be a tremendous additive measure to try to help us accomplish that.
Thank you very much, Dr. Douglas. And looking at the clock, it looks like that's the last question we have time for in this discussion. I want to send a heartfelt thank you to tonight's panel of experts, Dr. Douglas, Dr. Albanese, and Caitlin Silverstein, for answering questions and for sharing your knowledge with us during this call. I'd also like to thank everyone who joined us tonight on the call. You've asked many thoughtful questions. We appreciate you taking the time out of your evening to be with us. If you still have questions about vaccines, please visit Tri-County Health Online at tchd.org. Again, tchd.org. So on behalf of Arapahoe County and the Tri-County Health Department, thank you for sharing your time with us. We hope you'll join us again in the future for future town halls. Be well, be blessed, and have a good night.